I'm sure you've heard about high intensity focused ultrasound. Lately, it's become very popular in media. Is it a new treatment? Well, to your surprise, it's not a new treatment at all. It's been around for more than 20 years. But finally, it's deserving the recognition, partly due to media recognition. Let's discuss everything you need to know about HIFU and how to start your journey with HIFU. As the name suggests, HIFU is high intensity focused ultrasound. This ultrasound is not very different from the ultrasound that we do during sonography, like when you go through an abdominal sonography, but it is focused. Because it's focused, it focuses within the skin, creating a small pocket of heat. And this heat stimulates our skin to produce more collagen. Now the magic is that depending on the size of the cartridge or the depth of penetration, we can target different layers in the skin. So I can be at 1.5 mm, which is the dermis, and I can go deeper into 3 mm, 4.5 mm, which is the SMARS, the muscle layer, and in fact even into the fat layer when desired. The whole treatment is completely customizable, and each face is different. Bigger faces have fat compartment much deeper compared to lean faces like mine, where the fat compartment is more superficial. So the treatment has to be customized. Well, HIFU is best done preventively in the age group of 40 to 60, when changes have just started to begin and you are able to prevent a lot of these changes, which includes face sagging and fine line development. However, it can also be done for younger faces, mainly for face contouring. For someone with a fuller chin, under the chin area, or for broad faces, it can also be used to make the face look more leaner. With the right operator and right technology and the right parameters, it's an extremely safe treatment to be done. It's FDA approved, but do discuss your safety concerns with your dermatologist. Well, during the procedure, because the treatment is working at a deeper level, we don't really need to put anesthetic cream. We start by marking out the areas when you're sitting out so that we can plan the treatment. Once the planning of the treatment is done, you will comfortably lie down. We put some cold ultrasound jelly, and depending on the treatment planning, the ultrasound will be started. The energy is something that we can tweak during the treatment. So the procedure is slightly uncomfortable, but at any point it should never be painful. And depending on your skin, thickness of the skin and the treatment plan, the treatment can be completely customized as we do the treatment. We can do smaller areas like just the double chin area. We can do only the lower face. It is sometimes excellent for just the eye area. But for someone who's looking for a full face and neck rejuvenation, we may also decide to do the entire face and neck at the same session. The procedure will last anywhere between 20 minutes to 45 minutes depending on the area that we are targeting. Post procedure, you can expect probably minimum redness, which disappears over the next half an hour. We'll ice your face, put some sunscreen. You're allowed to put makeup right away, and you go about your day as usual. Well, HIFU is something again that can be customized on your need. It can be once in 6 to 12 months when you're doing it preventively. But as a holistic treatment protocol where you're doing a lot of other treatments around HIFU, the frequency may be even lesser. So let us plan your best treatment protocol so we know how to fit in HIFU in that. Also, you need to understand HIFU cannot be done over certain treatments. Like if you've had injectables like hyaluronic acid fillers, immediately doing HIFU on top of it in the next 1 or 2 months will heat up that area and actually cause loss of your facial fillers. Don't worry, we are here to guide you through that. With the right expertise, this risk can be completely avoided because we know that the facial fat is at a certain depth into the skin. When we are doing HIFU, we are more conservative. We don't go deeper and aggressively target the fat tissue unless we want to. So we can completely avoid that risk. Personally, I can tell you, I have a lean face. I really want to hold on to the facial fat that I have, and I have done HIFU a couple of times without targeting the facial fat. So when I do HIFU in the zone of dermis, I'm not going to the facial fat. So it can be done correctly. But yes, these concerns stem from aggressively done HIFU treatments for smaller faces where patients have actually lost facial fat because of over-aggressive treatment. But this can be completely avoided by carefully planning the procedure. So at Everything Skin and Hair, we've been doing HIFU for the last 12 to 13 years. We have 3 different HIFU technologies because each one offers a certain versatility over the other. So for your face, whichever is the best one, we will choose it according to that. Sometimes we even combine 2 different technologies because one of my technologies has a pen device which is great for areas around the eyes, but the other one has a linear mode which is good for facial fat slimming. of a body HIFU as well. At Everything Skin and Hair, it's strictly done by dermatologists. You get the best treatment protocol, optimum number of shots and results, and we are here to handhold you through the entire procedure. We only use FDA approved technologies, and we've had great patient reviews for HIFU as well. So now that you know everything about HIFU, it's the best time to schedule a consult, discuss this with your dermatologist and see if this is the right treatment for you. In the last 10 years, the one big change I've seen is people are more proactive about treatments such as HIFU, which are preventive in nature, rather than waiting for too long and then realizing it does not really work as well. So discuss this with your dermatologist today.